guys, I'm Dr. Andrew Iraniha from Surgical Oasis Institute. I'm a board-certified general surgeon and practicing in Southern California, Orange County for the last 20 years. And my main expertise is abdominal surgery and body contouring, including breast augmentation. Today, I'm not going to talk to you about the type of procedures that I do for breast augmentations. We're going to talk about actually safe breast augmentations, and we're going to go over the 14-point plan that I followed during the breast augmentations in my practice. So 14-point plan is designed to target the bacteria and decrease the bacterial contamination during the breast augmentation. So when we talk about safe breast augmentation is to follow the rules in order to decrease the bacterial contamination, because all the studies have shown that the bacterial contamination during the surgery can be associated with capsular contraction, breast deformity, breast pain, and breast hardening after the surgery. And one of the most important new findings related to the breast implant is called the breast implant associated anaplastic large cell lymphoma. All of those have some association with the bacteria. So if we follow some of the rules in order to decrease the bacterial contamination, then we can achieve a safe breast augmentation. The first thing that we do is a preoperative antibiotics. It's been shown that giving antibiotics prior to the surgery, within the 1 hour prior to the incision, usually decrease the risk of infection or bacterial contamination. So that's one thing that we do during the surgery. The second one is the type of incision that we do for breast augmentation. So majority of the studies shows that if you stay away from the breast tissue and also the nipple area, the risk of infection is going to be much lower. So the safest incision that is being reported is called inframammary incision, which you can see in this picture is done below the breast. The surgeries that are done through the axilla or umbilicus or around the nipple area have higher risk of bacterial contamination. The third point on the 14-point plan is nipple shield. It's been shown that the nipple has some minimal discharges during the manipulation of the breast. Even after prepping the breast with appropriate antiseptic medication, those secretions, they can touch the implant and create infection. So we usually shield the nipple with the appropriate plastic adhesive during the surgery. Now, very precise dissection is also very important, or essentially atraumatic, without major bleeding. If you have that type of dissection, it's always decrease the trauma to the patient's body and decrease the risk of infection and contamination. The other thing is very careful hemostasis. Means that we have to make sure that there's no bleeding during or after the surgery. People who have extra blood into their cavity of the fifth point is careful hemostasis. Means stopping the bleeding. We need to make sure that the field of surgery is clear and there's no bleeding from that area during the surgery or even after the operation, because blood it's a great environment for the bacteria to grow. So careful hemostasis is one of the 14-point plan for decreasing the bacterial contamination. Well, avoiding the breast tissue is another thing. Not going through the breast tissue and dissecting through the breast tissue to go under the breast or under the muscle is another factor to decrease the trauma and decrease the risk of contamination. So that's why one of the way of placing the breast augmentation through the nipple involves going through the breast tissue, and that's shown to be higher risk with contamination with the bacteria. So the other factor of decreasing the contamination is irrigation with a betadine or triple antibiotics. That's what we do. After I do the dissections and create the pocket, we irrigate that area with the triple antibiotics and diluted betadine. We also place the implant into the triple antibiotics and betadine before we inserting it into that area. The other factor is avoiding skin and implant contact. So we have a special sterile cone that we place the implant into the cone and going into the cavity and pushing the implant into that area. That minimizes the touching the skin with the implant during the insertion, which again has higher risk of bacterial contamination. The next is changing gloves and instruments when we insert the implant. I have a special ritual that I have to change my gloves and drape around the area of the breast that I created the incision again during the surgery in order to decrease the possibility of contamination. Another factor is to minimize the time that we open the implant on the field. In other words, the implant is still in their sterile appropriate packages. And when we are ready with the pocket, then we ask the nurse to open up the implant. That way, the implant is not exposed to the air and it decreases the risk of contamination. Now, minimizing the implant manipulation and reinserting it is very critical. So obviously, sometimes people go in and put the implant in and then the pocket is not appropriately done and they have to remove it or reinsert it, and that way they have the higher risk of contamination. So in my practice, I create the pocket very beautifully, the size of implants, and then we insert the implant once and not reinserting it again. Closure of the skin in multiple layers, it's give more protection over the implant and the space that the implant is located in order to decrease the risk of bacterial contamination. So these people after the surgery, because of the appropriate hemostasis, we do not required to put the drain in. Obviously, the placement of the drain can be an access for the bacteria to go to this space. So we do not recommend placing a drain during the surgery. And also prophylactic antibiotics, very important for these patients for a short period of time, and then also very long-term follow-up is very critical for these patients. In my practice, we follow up on these patients frequently and even in a long-term fashion to make sure that they don't have any type of long-term complications. In my practice, I follow the 14-point plan to decrease the bacterial contamination for safe breast augmentation. That way, it minimizes the possibility of the postoperative complications related to the breast implant, including breast deformity, breast pain, breast hardening, capsular contraction, and lymphoma related to the breast implant. If you like this video, please like my video and share that with your friends, and also subscribe to my channel. I have so many different surgical videos that go through the actual surgery, and also the educational videos that I talk about my procedures in detail. And also, if you would like to contact me directly, please call my office 949-646-8444 or put a comment on this video for me to respond. Thank you.